Actually, the same bracelet.
You like those bracelets?
Yeah, and this one.
Okay. Do you think they match your shirt? This is my daughter, Cammie.
Nope.
She's 3 years old. She loves to tell stories. She likes to sing. She likes to dance. She's definitely very feisty.
Not a baby.
Yeah, that's not a baby show. When she turned 3, she was diagnosed with neurofibromatosis type 1, NF1, related plexiform neurofibromas, PN, which is when benign tumors grow along nerves throughout the body. You ready for school? We know it's a lifelong journey for our daughter, and so we are in it. We're ready to move forward and keep it positive. Right before she was turning 3, we started to potty train her. In doing so, we noticed her peeing quite frequently, almost all the time. I assumed maybe she had a UTI or something. Her 3-year-old wellness checkup was coming up, so I figured we would talk to the doctor. We also had noticed that one side of her buttocks was bigger than the other side. There was some discoloration on the bigger side. The doctor was concerned. And so they did an ultrasound on her bladder, and then we found out that there was a mass. After an MRI, she was diagnosed with NF1 with PN. I cried a lot when I was by myself. My husband and I understood the seriousness and had a lot of worries. The biggest thing I learned is that this disease will impact her for the rest of her life, that it was a genetic disorder that she was born with. Because NF1-PN can grow rapidly in early childhood, timely evaluation and intervention are critical and can help change the disease trajectory. I have a lot of friends with kids and they don't have to worry about any of this extra stuff. How would this affect her growing up? What treatments were available?
Pretty and ready to go to school.
Fortunately, our doctor told us there is a treatment called Koselugo, selumetinib. The doctor told us that Koselugo would shrink the PN. It's possible to experience side effects with Koselugo. These side effects may include vomiting, stomach area pain, nausea, and dry skin. After discussing the side effects with our doctor, we decided to move forward with the treatment. We also learned about OneSource, a free, personalized patient support program offered by Alexion. I found that OneSource was valuable. It was at a time where we were not sure, what the future held. So far, her doctors have been pleased with her results on Koselugo. She has not had tumor growth. The side effects Cammie has had is just the dry skin, and it hasn't been severe. Cammie had a little bit of difficulty swallowing the pill. As expected for a 3-year-old, she didn't know how to do it, but she caught on very quickly. Cammie no longer has to fast while taking Koselugo. It made nighttime so much easier because we didn't have to make sure she finished dinner by a certain time. Of course, this is Cammie's experience and may be different from others. We're still working on that potty training. We've accepted NF1-PN as part of our lives. It definitely is comforting to know that Koselugo is a treatment option. Cammie does not know any different. She feels like a normal kid. Because of Koselugo, I am hopeful that Cammie can live with her NF1-PN. I am hopeful that Cammie will have a fulfilling life.
Indication and important safety information for Koselugo. Indication. What is Koselugo? Koselugo is a prescription medicine that is used to treat adults and children 1 year of age and older with neurofibromatosis type 1, NF1, who have plexiform neurofibromas that cause symptoms and cannot be completely removed by surgery. It is not known if Koselugo is safe and effective in children under 1 year of age. Important safety information. What are the possible side effects of Koselugo? Koselugo may cause serious side effects, including heart problems. Koselugo can lower the amount of blood pumped by your heart, which can be severe. Your healthcare provider will do tests before and during treatment to check how well your heart is working. Tell your healthcare provider right away if you get any of the following signs or symptoms: persistent coughing or wheezing, shortness of breath, swelling of your ankles and feet, tiredness, increased heart rate. Eye problems. Koselugo can cause eye problems that can lead to blindness. Your healthcare provider will check your vision before and during treatment. Tell your healthcare provider right away if you get new or worsening vision changes, including blurred vision, loss of vision, dark spots in your vision, floaters, other changes to your vision. Stomach, intestine, and mouth, gastrointestinal problems. Koselugo can cause diarrhea, vomiting, nausea, and mouth sores. Diarrhea can be severe with Koselugo. Tell your healthcare provider right away the first time that you get diarrhea during treatment. Your healthcare provider may give you medicine to help control your diarrhea and may tell you to drink more fluids. Skin problems. Koselugo can cause severe skin rashes. Tell your healthcare provider if you get any of the following signs of skin problems: rash that covers a large area of your body, flat skin rash, raised bumps on your skin bumps that look like acne, blisters, peeling skin, itchy rash, hair thinning or hair loss, alopecia. Increased level of an enzyme called creatine phosphokinase, CPK, in your blood, and muscle problems. Koselugo can cause severe muscle problems. Treatment with Koselugo may increase the level of an enzyme in your blood called creatine phosphokinase, CPK, which may be a sign of muscle damage. Increased level of CPK in the blood is common during treatment and can also be severe. Your healthcare provider should do a blood test to check your blood levels of CPK before you start taking Koselugo and during treatment. Tell your healthcare provider right away if you get any of the following signs or symptoms: muscle aches or pain, muscle spasms and weakness, dark reddish urine. Your healthcare provider may change your dose, temporarily stop, or permanently ask you to stop taking Koselugo if you have any of these side effects. Before taking Koselugo, tell your healthcare provider about all your medical conditions, including if you have heart problems, have eye problems, have liver problems. Females who are able to become pregnant. Your healthcare provider should check to see if you are pregnant before you begin treatment. You should use effective birth control, contraception during treatment and for 1 week after your last dose. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment. Males with female partners who are able to become pregnant. You should use effective birth control, contraception during treatment and for 1 week after your last dose. Are breastfeeding or plan to breastfeed. It is not known if Koselugo passes into your breast milk. Do not breastfeed during treatment and for 1 week after your last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription, over-the-counter medicines, vitamins, or herbal supplements. Certain medicines may affect the way Koselugo works. Especially tell your healthcare provider if you are taking a supplement containing vitamin E, aspirin, blood thinners, or other medicines to treat blood clots. Koselugo capsules contain vitamin E, which may increase risk of bleeding. What should I avoid while taking Koselugo? Avoid St. John's wort, grapefruit or grapefruit juice, and Seville oranges during treatment. Most common side effects in children include vomiting, diarrhea, increased level of an enzyme called creatine phosphokinase, CPK, in your blood, dry skin, redness around the fingernails, nausea, skin bumps that look like acne, fever. Most common side effects in adults include rash, diarrhea, skin bumps that look like acne. These are not all the possible side effects of Koselugo. Call your healthcare provider for medical advice about side effects. You may report side effects to AstraZeneca at 1-800-236-9933 or at https://us-aereporting.astrazeneca.com or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see patient information and instructions for use in the full prescribing information for Koselugo, selumetinib, or at https://alexion.com/documents/Koselugo_USPI.pdf.